Hello, fellow hospitalists, and welcome to Documentation Talks with Dr. Tom. As always, our objective is to help you get credit for the great work that you are already doing, as well as to help you avoid queries. In other words, we would like to help you document like a genius. Today's topic is kidney injury. Let's start with acute kidney injury. Complete and accurate documentation of acute kidney injury only requires that you link it to an etiology. Please keep in mind that probable and suspected etiologies are acceptable. An example of complete and accurate documentation would be acute kidney injury due to septic shock. Now let's go through a few tips that are important when you document acute kidney injury. The first has to do with acute tubular necrosis, or ATN. It is important to note that ATN is a major comorbidity, and as such, if you have probable or suspected ATN, you need to document it. And also keep in mind that acute kidney injury that is not responsive to a fluid bolus is probable or likely ATN and should be documented as such. The second tip has to do with the wording acute renal insufficiency. Acute renal insufficiency is considered nonspecific by the coders, and if you use that terminology, it will result in a query. The third point is about definitions. The definition we use in our tip sheet is the kidney disease improving global outcomes criteria, and it's good criteria, but there are other criteria, including rifle and akin, and the criteria you use is really up to you, and they all work just fine. Now, for a brief word about chronic kidney disease. It is a best practice whenever you document CKD to link it to an etiology, but it is required that you document a stage. The tip sheet lists all the stages and the associated GFR with every stage. An example of complete and accurate documentation of CKD is chronic kidney disease, stage 3B, due to hypertension. Now for a quick recap. To document acute kidney injury, all you need to do is link it to an etiology. Please keep in mind that if your patient has probable or suspected ATN, you need to document it, as that is considered a major comorbidity. And lastly, whenever you document CKD, you need to document a stage. It's really that easy, hospitalists. Thank you so much for joining me. We hope you enjoyed it. Please stay tuned. Next month, we're going to be covering some foundational topics about why our documentation is so important.